tops all the time and shorts if I could, but, so compromise is sleeveless. But I knew I was just doing foot today, that's why I have jeans on, and that's why I've got short sleeves instead of sleeveless. Something you'll also learn, you guys, this is such a great place to be, is at the start of this. Something else you'll learn is that even though we have all these paired muscles and paired organs, they'll be different on each side. They can be completely different on each side. So don't assume because you found an adhesion in one point on one muscle on one side, there will be a matching one on the other. There might not be one, it may be in a different place.
Yeah, my mom lifts weights, and so she tends to have really bad adhesions on her left leg.
Mm-hmm, mm-hmm.
Something I found out this weekend.
It'll be interesting too to see how her dominance affects where the tension shows up in her body too.
Mm-hmm. And the worst part is that she has hip problems as well, so it's
But
on that side.
You'll learn to work those guys. I bet you'll be able to help her a lot by third quarter. A lot of what I'm doing right now is I'm doing kind of a deep effleurage because I use that to sense. But what I'm doing is kind of a soft MFR. I'm pulling because there's a lot of muscle attachment here right behind the knee, and I'm pulling that, trying to pull that away from the joint. I'm always trying to open joints, open up spaces between bones. Ooh. Sorry, I got distracted. I found an adhesion. Just because gravity is a relentless force that we're all subjected to 24/7. So that's why traction and creating space and doing those micro stretches in spaces make people feel fabulous. It just gives the body a little bit of a break. And something too, when you're handling extremities or the head, be really careful about keeping your client feeling secure. You don't want to don't pin down ankles and wrists. That makes people who aren't even susceptible to emotional triggering, that can make you feel really trapped. But cradle, a lot of time the image I use for myself is to try to recreate. Have you ever seen a guitar stand?
Mm-hmm.
They've got that little hook at the top where the neck just rests in it. So it's supported, but it's not contained or restricted. So that's kind of the image, I'm always trying to get to with my limb and head holds. Because if somebody drops your ankle in a good session, that can really ruin your buzz. And you've lost the body trust. You've got to start over. And once you've lost it, it's a lot harder to get. If you've talked to the body and have promised to listen well in that opening touch, then you can get lots more done. Their body's going to do a whole lot more work. It's going to give itself more space to do it.
So if you were doing like some of the drainage you were talking about, wouldn't you go like towards the head?
If that was my focus, yes. And I tend to close that way too. I do a lot of, my opening is, that initial contact with the body. That, yes, I'm going to listen, you just have to talk to me. And then I do the work, and I tend to do those return things as part of my closing. Because we've gotten work done with things loosened, released, so for the body to handle, and now it's like, okay, help that track that get out of the area, and the good stuff back in. And the luxury of a 30-minute session just on feet is you don't have to rush anything. Because the long, slow, deep strokes are more relaxing. You can also use Tuputman on the feet to invigorate somebody if you're doing like a quick session at work or something, or in the workplace or sports event or whatever. You can do quick Tuputman stretch stuff with the feet and send them on their way, and it's it's kind of energizing. And I'm not asking her about this, it's an old bruise, it's yellow. So obviously if it were a new bruise or a fresh one, it would be, how sore is this? Because I don't want to grab it and have to peel them off the ceiling. You got to start over with the relaxation when you do that.
What if what's the protocol if you notice like over time a lot of bruising and what is the, I don't know, how deeply do you want to dive into, are you being abused or?
Well, from here down, that kind of bruising is really unlikely to be a concern. They're not being, if it's arms and in the hands and her neck and back and those kinds of areas, that's a different thing. And the pattern will be different, completely different. I have clients who have they've got a zone where they're always bruised or banged up. They hike or they do something where that's always where they get whacked. So it's like I just know if it's raw, I avoid it. Otherwise, I just. But there's not a protocol per se. I think as healthcare providers and as human beings, you voice concern. But I don't know, and I've not heard that the board's going to require reporting like they do for physicians. That doesn't mean it's not on an agenda somewhere. I just haven't. Fortunately, I've not had that come up in my practice.
I would imagine people like that don't routinely get body work.
Well, now here's a myth for you. Abuse, like alcoholism, is no respecter of socioeconomic class. People with power issues and power problems can be wealthy just as easily as they cannot be.
Well, I wasn't thinking that. I'm just thinking, do you have any, physical things that you want to hide? Why would you necessarily get body work?
Well, here's the thing. Clients trust their therapists. That is huge for our work, and it is key to what they can do for themselves in a session and what they'll be able to accomplish. And that may be the only soft, trusting, nurturing, non-judgmental relationship in their life. And for me, the feet are very individual. One client, when I started calling hers by name, and they have different names because they're completely different creatures, she's like, okay. I mean, I like my feet, but okay. But they really are characters. And I think part of the reason they tell you so much is that they're not used to a lot of feedback and support. Somebody timing me. Yep. So this is a lot of long, slow work. You guys know about slowing down when you hit a knot. if you have someone with plantar fasciitis, you want to do a lot of stretching in that. Because you've got, part of the beauty of working that is that you got them off their feet, so you're not trying to counteract anything that's already aggravating the situation. And you can do a lot of stretching. So those arches, that was the big thing I wanted you to get from all the A&P stuff. There's the medial longitudinal that runs this way, lateral longitudinal, and then this across the ball of the foot. So my focus tends to be to try to relieve stress along those arches.
By squeezing and pulling?
Yeah. And I also tend to work from the bones out. That's one of the reasons I wanted you guys to spend a little time just looking to see what all's going on in that area.
Now, are you applying the pressure that you are currently applying because you're familiar with this client, or because you're just going on like intuition?
That's part of the opening. Because the feet, you guys will, well, you've worked each other's feet so far, right? Okay. So feet really actually can take quite a bit of pressure. I probably use nearly as much pressure with the feet as I do anywhere else. And unless you have adhesions or something going on, they don't tend to be tender like a big bellied muscle. If you hit a knot, it can be really tender. Like on me, the muscles of my lower legs they're always going to be. It's like talk to them gently, and then before you do that deep work. Because Zephyr has received my work before, her body triggers to it quicker. But I don't ever take for granted what's going on. I never assume that, oh yeah, this is how this was last time, so no. Things change for folks. They use their body differently. They institute a new exercise program. They stop doing something they were doing. Something changes in their life. And kind of a warning too with full body. I have a client in particular that's a good example of this. She's prone to trigger points in a particular shoulder. And if I don't release that knot that corresponds to it in her foot, that thing's reset before she gets out the door. So if you've got a client, part of the beauty of starting with feet is you've got that full body, you're getting that full body awareness on a level. So when you find something in the rest of the session, be sure to check with that corresponding area in the feet too, to make sure you're relieving any adhesions there. Or trigger points. You can have trigger points in your feet too. And I also focus on joints quite a lot. Because where bones articulate, they've all got fluids and ligaments and cushions, things built in to cushion them, but they're squished together all the time, usually with most of our body weight on them. So while I have a client on the table, I try to come in and create some space in there. And when you get MFR in your belt too, the feet are a great place for small scale MFR, myofascial release.
Oh, okay. Now how would that, your technique, that's stretching and pulling the muscle, right?
Mm-hmm.
Okay, so how would that be different than pulling and like what you're doing?
Well, one of my favorite things to do with MFR is to find a bone as one of my anchors and then stretch the muscle attached to the bone.
So it'd just be what you're doing except deeper?
You got all kinds of bones in the feet. So, for example, pick this one, this little muscle that runs here in the arch. You anchor on the underside of the hallucis bone, and then just stretch from that. You're only having to keep track of one moving in.
So you're
And everything you learn in the feet, you can apply to the body and vice versa. I was always, every time we'd learn a new technique in the shoulders or low back, I'd come back to the feet and figure out how to apply it. I'm sorry, somebody had a question?
I wanted to ask a question. You said you work from the bone out. Does that mean that you go deep
down to the bone and then.
Here. Because for me, this is why bodywork is so creative, because it's very mental. So I'm mentally going down and talking to the ankle bone and the tibia and fibula and all the metatarsals. And then too, when I start this kind of stuff in the soft tissue, because the bones are already alert, you can feel them shifting out too. And feel the metatarsals spreading. And it lets you get in between things a lot easier.
Any particular techniques we can use when the diabetes people start having numbs on their foot?
Pins and needles. Like,
I work their feet just like I do anyone else's. I basically just chart that kind of progression because it's nerves, and we can help fluids flow and help keep things as nourished as possible. Because eventually that nerve death does impinge everything else, and that's how you end up with amputations. But yeah, I don't have a protocol specific to. That doesn't mean there isn't one, that you might not learn one.
What do you do about calcified joints? Basically, joints that have growths on them.
The touch gets really light. I still talk to them, and I will still work them. And you can. It's just be careful because you're basically working with. Everybody understands what he's asking, right? And it's extra bone. That's where it doesn't belong. A lot of it is just being careful and just working gently around that side. But I don't ever not incorporate it.
I thought it was calcium deposits.
Well,
Like
it
from
can
your
be.
diet or
It can be osteoarthritis, for that matter, which is degenerative. And if you live long, it's like cancer. If you live long enough, you'll deal with some of it. RA is inflammatory, but osteoarthritis is aging.
It's in the joints.
It can be in the joints. It can be along bones. You can have people in the feet. You can have people who've had broken sesamoid bones, and those little fragments. The body tries to cushion them and enclose them, but you can still get edges of those little fragments you've got to work around too. And I tend to work more circularly there than linear, because the linear is what kind of seems to rub it back into the foot. But so that all kinds of stuff can happen with the feet. So the calcifications, random calcifications, calcified cysts, broken sesamoid bones. Because sesamoid bones are one of them that they don't set. I mean, they're those tiny little guys that sit at here to help relieve pressure.
So about the same as with Graves or something. If someone were to have Graves syndrome,
Mm-hmm.
which is about the same as
Yeah.
calcified.
Yeah. And the thing is, the beauty of having a diagnosis is and you know how to adapt your protocol, but people don't often know. And people can have signs of a disorder and not have the disorder full blown.
And generally, if you find signs of that disorder, do you tell them to go to a physician to get it checked out, get a diagnosis, something like that?
It depends on what it is. We aren't physicians, we don't diagnose.
Mm-hmm.
If you see something that concerns you and you can't tell from their health intake form that it's already on their radar, yeah, I do.
Mm-hmm.
And part of my closing, what I start to do is work to the edges of my field. So I'm working a little above where I was before in our knee joint. And then I'll bring long, slow strokes all the way to her toes. And I've been working fairly deeply, so part of what I do with closing too is each stroke is lighter. Telling the body that you're coming out. may have any questions, any reflections, what in the world were you up to?
I know this is probably in the interest of time, but in a normal session.
You're stuck with me till 2:30, so do what you want with that time.
In like a normal, like non-classroom setting, and you're doing both right and left, like, I don't know, I guess my question is, would you normally just concentrate on the right, left leg, or the?
Do I work one leg at a time?
Yeah.
Yes. I open by talking to both feet, and I close by saying goodbye to both feet. But I work them individually because, as you guys have learned from your overview of feet and lower legs, there's a whole lot going on. That's enough to keep track of one at a time. Now, what I tend to do is I might make a mental note of, okay, there was an adhesion there, but I don't expect to find. I'm not looking for it to match in the other leg. Just okay, there was some tension in that zone. So I tend to look in that other zone to make sure it's clear, or to make sure whether or not it needs attention. So.
You're not just doing one more, right?
No, I'm not.
Oh, thank goodness. Oh, that was
What,
really
have you walking
stressing
around,
me out.
have you walking around half done? You can't have
I
that.
was gonna walk around in a circle. There's a little bit of jammed up in my left navicular.
Okay. That's the navicular is this bone, and it's kind of that outer edge of our arch. So it's a pretty common place for people to notice tension if they're aware of their feet.
Does it like feel like your legs tear right here?
Oh yeah. Well, in that one, that's a big zone for me, and the tibialis anterior gets involved there. And when you guys start getting tests and you have to find trigger points on people, this is unsolicited graduate advice. That's a great place to find trigger points on most people that they're completely unaware of.
The lateral.
Just
So,
outside the shin bone.
That's not a health code violation or anything to, like, in a work setting, to not have your shoes on?
I don't work in a clinic. I don't work at a chiropractor. I don't work at Massage Envy. I work by myself in my home studio or in my clients' homes. And different work environments will have their own sets of rules. There are some chains where they don't want you on the table. So techniques that you'll learn later on where you get on the table to get the right angle to get straight into something or get enough pressure on it, you can't use in those places. Those are all kinds of considerations you'll have to sort of keep track of for yourself when you're starting to get out there and work and look for where you want to work. It's like my table set up at home I have a fluid barrier on the table. Linens are clean every time. I use quilts, but they're washed once a week. Even though since it's a home studio, I'm not right now subject to inspection, but I'm not interested in doing anything counter to my client's health either. And if you've got somebody on the table who's a runner, really pay attention to their outside of their legs, because the circular hip joints, when you guys start studying the hip joint, it'll be another fascinating zone. They're kind of a 360 rotation, and they can transfer a good bit of tension down the outside of the legs too. You know, a client who wonders why their calves are tight, they're not doing calf presses with 200 pounds, but they're running. So that it's coming from somewhere else, but that's where it's resting. Yeah, when I traction this ankle, I can really feel that navicular shift. Ooh, this one's a lot tighter too. Because since you specifically said the navicular, what I'm trying to do is traction it to get released this way and this way, so that when I stretch and stretch back against it, it's got room to do that too. It's loosened up her arch too. And my technique is also pretty gentle. I'm not into flipping and dropping and wrenching things. I'm not a devotee of Thai massage. I don't practice Thai massage. But there's a technique in it where you pull the toes and flip them. To me, that's like, if they like that and you're trying to energize them, fine, but that's not. To me, it's all about having the conversation with the body. And don't forget, when you have time with a foot massage, there's a foot model over there if you guys want to see it, but be reminded about all those little joints in the phalanges. And you can lightly traction anywhere. And standing lets you, even though I usually do a lot of footwork sitting, standing and makes it easier to do, to kind of traction as you go. What I'm doing here is, it looks like cross fiber friction probably, but what I'm doing, because I want to talk to the bones and loosen up all those interior ligaments, what I'm doing is spreading them. Because you've noticed when you study the foot that everything's linear, everything goes from your heels to your toes. When you get all that warmed up well, you can start at the heel and spread it. Move everything laterally. Yeah.
We're going left and right.
Yeah. Yeah, I'm starting at the opposite side and just pulling. I'm using a fairly deep pressure because the tissue's warm. If you're doing that just to look for knots or stuff, use a lighter pressure. Because part of what I like to do with joints in particular is just to let them do something they don't normally do. Because that's what a rest is for anything, and then us is doing something we don't normally get to do.